So here in the IMW meeting in 2019 in Boston, we have had an educational session on novel targets and novel therapeutic agents in multiple myeloma. We have reviewed the current practice with the novel generation of currently available agents, such as we have melflufen or iberdomide, the novel generation CELMoD, that I think they both have quite promising results. Also, we have reviewed some of the novel agents that are coming or novel targets that could be targeted and used for the treatment of myeloma patients. In this regard, we have spoken about RAS family members and how we can target different pathways or different strategies targeting RAS or RAF or even MEK. Also, BCL2 is an important target, and now in myeloma we have venetoclax, venetoclax monotherapy, particularly in patients with translocation 11-14, but also in combination with bortezomib dexamethasone, with some problems in the survival. But I think this is an important target. Also, regarding this BCL2, we have MCL1, which is a family-related protein, and we consider that MCL1 inhibitors are interesting and could be something potentially useful in the future in multiple myeloma. Finally, I think what is also very interesting, and here there are some highlights in this meeting, is the immunotherapy again. We have heard some updates on immunotherapy in multiple myeloma. We have heard about the ADC, elnatamab, the antibody drug conjugate, with again the 60% responses, very promising results. Also the bispecific antibodies, the AMG 420, that combines the BCMA and CD3 with 70% responses at the highest dose and at the recommended dose. So I think also with some MRD negative, important and interesting results. And finally, again, as in many of the last meetings we have had, the stars are CAR-Ts, and we have seen some updates on CAR-T therapy with the results and toxicity. And what I think is more important, some new ways to improve the activity of CAR-Ts and to improve the persistence of CAR-T and the efficacy of them. In this regard, we have bispecific or CAR-Ts targeting the dual antigens, CD38 and BCMA and CD19. We have also seen some preclinical data of NK CARs, which I think could be also promising in the future. This is preclinical, should be taken into the clinics, and also allogeneic CAR-Ts. I think so. We will have off-the-shelf CAR-Ts that I think would be also interesting. So in general, what we can say is that we have many novel drugs, many novel targets coming. Some of them are already in the clinics, and we have seen responses, and some of them will have results in the near future. So the future is promising for our patients.